Thank you all for spending your morning with us. We've got some amazing topics, and I'm excited to share those with you today. My name is Ainsley Nelson. I oversee communication for Covenant, and I'm honored and a little nervous to be up here today introducing our great panelists that are going to share a lot of great things about women's heart health. And I'm excited to see so many ladies from here. How many of y'all are from Lubbock? Is there anybody from outside of Lubbock that's here? Look at y'all, fantastic. Anybody from outside of Texas? How about that? Fantastic. Well, thank you all for being here. So just to go over a little bit of the purpose and some of the panelists that we're going to have for you. The purpose of this is, you all know, heart disease is the leading cause of death for women in the United States. And women have very specific risk factors that can influence our heart health. And because our symptoms are very different than men, it oftentimes leads to women being misdiagnosed. So our objectives are for us to learn about the risks and the symptoms, and also some lifestyle changes and treatment. And some of you may be thinking, what am I going to do and change in my lifestyle now? I'm almost 54. I remember hearing from some of our doctors not that long ago, it is never too late to make any changes in your life. So if you think, gosh, I was a smoker for 20 years, gosh, I don't get any exercise, it is never too late. And I think some of our panelists are going to talk about that later. When you think exercise, it's not when you were in high school PE class, running the track or anything like that. Exercise looks very different than it did a long, long time ago for some of us when we were in high school. So we have 3 panels for y'all today. Just so you know, this is going to go straight through. We've got a brief break in between each panel so that our physicians can come up to the stage. So if you need to go to the bathroom or anything like that, please get up and go do so, but we will not have any formal breaks in between each panel. Okay? Everybody good with that? Okay, so the first panel is heart disease and prevention. And we're going to welcome Dr. Haley Hughston, who is a cardiology and internal medicine physician with Covenant Cardiology Associates, and then Dr. Holly Lewis. And she is a family medicine doctor with Covenant Medical Group at Family Medical Clinic. And their topics that they will cover, so also everybody should have received a little insert that has a place for notes. Start making your questions along the way, and we do have a Q&A at the end of each panel. So if y'all have questions, jot them down during the presentation. But they're going to talk about an overview of heart disease, symptoms, risk factors, and strategies you can take to minimize your risk. Panel 2 is going to be managing cholesterol, high blood pressure, and diabetes. And our panelists there will be Dr. Ramya Undamatla, and she is a board-certified endocrinologist with Grace Clinic here in Lubbock, and Dr. Marina Iskender, a board-certified cardiologist at Covenant Cardiology Associates. And they will be talking about the impact of cholesterol and high blood pressure on your heart health, factors that can lead to both of those being high, a connection between diabetes and your heart health, and managing and treating diabetes, including nutrition and medications. So that is panel 2. And then panel 3, of which I'm personally very close to now, is menopause, hormone replacement therapy, and heart health. And that will be Dr. Hughston again. We will have her back on stage. And also Dr. Bennett Henderson, who is a board-certified OB-GYN with Covenant Medical Group. And those ladies will cover stages of menopause, how hormonal changes affect the heart, managing the symptoms of menopause, which is why I'm in a very lightweight, cool shirt today, in case I start sweating, and hormone replacement therapy. So, any questions so far? Everybody's good? Okay, so a few housekeeping items. If you have not found the restrooms, they are out this door to the left. So there's restrooms if anybody needs to go. If anybody needs pens, we do have some extra pens on the table in the back. This is being recorded, so please know this will be recorded for those people that were unable to attend. We're going to make it available online for people to be able to watch the seminars sometime next week. Please silence your cell phones. If you have questions for the panelists, we will have a brief Q&A after their presentations. If you do need to leave, like I said, during their presentation or in the Q&A, feel free to do so. We all have things we need to step out for. And then we also want to encourage y'all to take advantage of the free blood pressure checks. If you have not done that, that'll be going on throughout the day, and it will be going on after the presentations. And then we've got some great tables in the back for some information to share with you all. The other thing I wanted to let you know, I already did that. I jumped ahead of myself, so I think we're good. Okay, so I want to welcome to the stage our first panel on heart disease and prevention. We have Dr. Haley Hughston and Dr. Holly Lewis. Yay. Do y'all have the clicker? Okay, good. Very good. And just so y'all know, Dr. Hughston and Dr. Lewis. All right.
Good morning.
Dr. Hughston, it's all you.
Okay, so I'm going to click through some slides.
Can y'all hear?
Okay, I might have to switch over to the microphone. Sorry. Can y'all hear me better now? Okay, all right. Well, good morning, everybody. Thank y'all for being here on this Saturday morning. So heart disease is kind of why we're here. We're going to talk about heart disease and how it pertains to women. So these are the scary numbers that I'm going to talk about first. So 45% of women over the age of 20 live with some form of cardiovascular disease. 1 in 3 women will actually pass away from heart disease, and that is more than all the cancers combined. So this is very important for everybody in the room. Women are also, unfortunately, less likely to be diagnosed with heart disease compared to men, and have delayed diagnosis, which often leads to worse outcomes. So one of the things we want to focus on today is knowing our risk factors, knowing our symptoms, and what we can do about it to hopefully change a lot of these statistics. So I have patients that come to me every day and they say, well, I have heart disease, or a family member of mine has heart disease, and that means many different things. And so I always like my patients to be as educated as they can be when it comes to their health, so that way we can work together to prevent the bad outcomes. And that first starts with knowing what does heart disease mean? So if we're looking at this diagram, and I'm going to start up in like the kind of 1 o'clock position, the first thing is valve disease. Valve disease can either be stenosis, meaning narrowing of the valve, it doesn't open all the way, or regurgitation, the valve doesn't close all the way and the valve is leaky. Moving to like the 3 o'clock position, you can have aneurysms, that's dilations of the vessels. Those can occur anywhere in the body. People are often very familiar with brain aneurysms. You can have aneurysms of your aorta, which is the big vessel where all of the other vessels come from. There can be cardiac arrhythmias. There are many different kinds of arrhythmias. This is an electrical problem within the heart. Some of the more common arrhythmias that you may be familiar with are things like atrial fibrillation and atrial flutter, although there's also the scary arrhythmias like ventricular tachycardia and ventricular fibrillation. Cardiomyopathies, there's several different types of cardiomyopathies. Some are genetic, some are not. One that you hear about a lot in the media is like hypertrophic cardiomyopathy. That is more genetically mediated, and when you think about that, you think of young athletes who die on football fields. It's problems with the heart emptying. Pericarditis, so our heart sits in a sac called the pericardium, and sometimes that sac can become inflamed. There can be many different reasons for it, and that can lead to something called pericarditis. And then heart failure, that's a big thing in cardiology, and that's a problem with the pump. Sometimes the pump doesn't squeeze hard enough, and sometimes, a lot of time, the pump is too stiff and it can't relax well. And so for both of those things, it's hard for blood to move through the heart. And so it can back up in your lungs, it can make you short of breath, it can actually back up into your belly, and it can make your belly kind of distended, and you can have GI problems from that. It can back up into your legs, and you get swelling, where if you push on your legs, you leave little divots. And then the thing that we're going to kind of be focusing the most on today is coronary artery disease. So what is coronary artery disease? There are many different names for it, and that's one of the annoying things in medicine. We can't call, something just one thing. We got all these names for it. So CAD is, of course, the abbreviation. Ischemic heart disease. Ischemia just means that you're not getting enough blood flow somewhere. Okay, so you can have ischemia of your kidney or ischemia of your liver. So ischemic heart disease is you're not getting enough blood flow to the heart muscle. Atherosclerosis or atherosclerotic heart disease, which is plaque or cholesterol buildup, or just blocked heart arteries, kind of for a layman's term. So in the beginning, we have our healthy arteries. You can see that on the left. This is when we're, children and young adults. And then slowly over time, we have plaque or cholesterol buildup that occurs. That's the yellow stuff that you see in there. And when it's mild or moderate or less than 70% blocked, we don't really know that it's there. But as more time goes on, it can start plugging up the arteries, and we can start having symptoms of coronary artery disease. And I'll talk about that more in the coming slides. And then eventually you can develop near or complete blockages of the arteries. And this happens slowly over time. So this is a little bit different than a heart attack. So not everybody who has coronary artery disease has had or will have a heart attack. A heart attack happens much more quicker. So you can see in the kind of blown up version, the yellow stuff is the plaque. And that plaque can rupture or break open, and then you form, and the blood doesn't like that, and so it forms a blood clot right on top of that, and that happens quickly. And those are usually the patients that come to the ER with, the excruciating chest heaviness, tightness, or pressure. And you can see where that plaque develops and that blood clot occurred, and downstream from that black area, that is the part of the muscle that is no longer able to get blood flow. And if that's left unattended, that piece of the heart can die, and it doesn't squeeze well. And that can then develop into heart failure because it becomes scarred. Microvessel disease is also a form of coronary artery disease. Now, I like this picture because in A, you can see, these are the vessels that I can see in the cath lab. These are the vessels that we have stents for, and we can balloon open, or we can do bypass on and get around those blockages. But that's not the whole story. Our hearts don't look like A, they look like B. And you can see where those big vessels, how they actually end. They end in vessels that are less than 1 millimeter in diameter. We can't put stents in those. We can't do bypass on that. The slide B is what responds to medications, okay? And unfortunately, microvessel disease is much more common in women. It's not to say that men can't get it, but it is much more common in women. And so microvessel disease is when you have spasming or clamping down of those microvessels, and you're still not able to get blood flow to the muscle. So let's talk about symptoms of coronary artery disease. Now, I'm sure everyone's in here heard the term or the terminology chest pain. I don't like that because most patients don't describe it as painful. Now, the number one symptom for men and women, though, is chest pain, but I like to call it like chest heaviness, tightness, pressure. Patients tell me it's like something sitting on my chest or my bra's on too tight. And it's classically worse with exertion or worse with stress and better with rest or nitroglycerin. But women often present with more than one symptom, and that's some of the reasoning why it's thought that women have delayed diagnosis and delayed treatment is because the picture gets confusing. So women can have sweating, they can have chest heaviness, tightness that radiates to your jaw or your teeth or to your left shoulder and down your left arm. If patients come in and they tell me, my chest hurts and it goes up to my jaw and my teeth hurt, I am very concerned for coronary artery disease. That's a very concerning symptom. You can have dry mouth. Sometimes it can be more GI symptoms like nausea or heartburn or even vomiting. You can have that numbness and tingling down your left arm. And so if these are symptoms that you're experiencing or that other people are experiencing, you need to be evaluated by your physician that you're seeing. So let's talk about some risk factors. Now, I'm not going to go into these in detail. That's for the next panel. But there's traditional risk factors that most of us already know. High blood pressure, high cholesterol, diabetes, age, unhealthy lifestyle habits, and family history of coronary artery disease, especially if it's younger. So in men, if it's less than age 50, same for women. So younger presentations of coronary artery disease. Now, there's also women-specific risk factors that I think most of us would be surprised to know. So autoimmune disorders are more common in women, and these are things like lupus, rheumatoid arthritis, to name a few. And because they're more common in women, that's why we call them women-specific. That pro-inflammatory state that you're in when you have these autoimmune disorders, it advances or accelerates coronary artery disease. Depression and anxiety is also something that accelerates coronary artery disease, and women are more likely than men to have depression and anxiety. Polycystic ovarian syndrome is another one. There's diabetes or glucose issues with that. Estrogen and testosterone hormones can be off with polycystic ovarian syndrome, and that also accelerates coronary artery disease. And the one I want to really raise awareness to is pregnancy-related complications. So pregnancy is like nature's stress test for the heart. And so if you're developing things in pregnancy like gestational hypertension or high blood pressure, gestational diabetes, preeclampsia, or preterm birth, those are things that foreshadow cardiovascular disease down the road, even if that stuff goes away once the baby is delivered. And so the American College of Obstetrics and Gynecology recommends that women who have these issues in pregnancy be screened for cardiovascular disease within 3 months of delivery. Now, that doesn't necessarily mean like a stress test and things, but you need to see your primary care physician about getting your cholesterol checked, checking your sugars, checking your blood pressure, looking at your family history, those sorts of things. Okay. Right. So I'm going to hand it over to Dr. Lewis.
Hello, good morning. Can y'all hear me? Okay. I'm going to talk about kind of prevention, but also having a primary care physician as your home base really to keep you healthy. Ultimately, the goal that for all of us is to be empowered to take good care of ourselves throughout our lifetime so that hopefully these things aren't happening, but if they already have, it's never too late to get control of lifestyle. A little selfless plug here. I think everybody deserves to have a primary care physician. That's your home base for your health care. So we do it in primary care. We do a lot of coordinating with specialists and things that you need, but that's also where we start the screening. So it starts with your vital signs. How does your blood pressure look? What is your heart rate doing? When are we appropriate, and what does your cholesterol screening look like? Are we screening for diabetes? All of that. So it's the first safety net. So I think everybody deserves to have a primary care physician, and it's okay if you're looking for one and maybe the first one's not the right fit. Doctors are people too, and it's got to be a good match, right? So it's okay if you need to look for somebody who matches your personality and your style. Because at the end of the day, you want to have a good relationship with that person so that you can be open and honest about what you need, and they can be open and honest about what's best for you too. So getting your annual exam, that's where we set that safety net. Also in primary care, we're screening for everything else too, or at least that initial safety net of, okay, what are our cancer screenings, and are we up to date on those, and how is our bone density, all of that good stuff. So we get to bring it all into one place. Healthy habits, so having a healthy lifestyle is more empowering than really anything that we can prescribe or any supplement that you can take. It starts in childhood, staying active, eating a healthy diet, lots of fresh fruits and vegetables, that just being kind of a normal part of life. But you can start at absolutely any age. It's never too late to try to get back to nature as much as possible. So for regular exercise, we recommend 150 minutes a week of exercise, and that should be moderate intensity exercise. Moderate intensity is like doubles tennis. You're running around, you're breathing heavy. You cannot sing, but you can talk. So you want to be breathing and sweating some, but you're not breathless. And I say whatever exercise you like to do. If you like to take the dog for a walk, if you like to go for family evening walks after dinner, if you like to garden. I've been gardening a little bit this week, and it's hard. I've been breathless a few times. So whatever your exercise is, just making sure that we're getting it consistently throughout the week. For nutrition, really it's for your whole body, but specifically for your heart, the Mediterranean diet has really good evidence to support it. You can find good stuff online about the Mediterranean diet. Even the American Heart Association website, I just checked it again this morning. It's really straightforward, and being able to find good dietary things. But again, fresh fruits and vegetables, whole grains, lean meats, fish like salmon, tuna, things of that nature. But also watching how much of simple carbohydrates you're getting, so your sugars, your breads, pastas, but also just getting back to nature, so trying to stay away from the processed foods and high salt foods. So if you do smoke, stopping smoking is highly, highly recommended. If you did smoke in the past, it's okay. You're done with that, and congratulations. We don't want to start smoking. Don't let your kids start smoking or vaping. It's very important because smoking damages your blood vessels, and as Dr. Hughston said, once that damage is there, that's when we can potentially get in trouble. Limit alcohol intake. So I know, especially when I was younger, people would say, well, I'm drinking red wine to protect my heart. But there's actually been some newer research that says even a moderate amount of alcohol intake, so that's about 5 ounces once a day, even that actually does put you at higher risk for heart disease and other conditions too. So alcohol is not something that you need to protect your heart, and it shouldn't replace your healthy lifestyle, so your diet and your exercise. Getting regular sleep, 7 to 9 hours really is what's recommended for most women. Keeping just a healthy routine, that's a hard one for me too. But our bodies heal while we sleep, so it is important for you. Stress management, so that is broad. If it's keeping your relationships healthy, if it's getting enough sleep and enough exercise so that you feel good. But there's also plenty of mindfulness activities that you can do. One of my favorites is yoga, because you get to be mindful and connected with your body, but you're also exercising. Tai Chi is good, Pilates is great. So whatever it takes for stress management for you. And sometimes that is what we do in a primary care setting is, all right, what else do we need to add to this so that we can get you feeling better? And dental care, we don't usually think about it with our heart, but really it's important. If you, let's say worst case scenario, if we go a long time without having our routine dental cleanings and touching base with your dentist, over time that bacteria that collects at the gum border can actually break off and go to the heart and cause severe infection. So just, again, holistic, whole body, whole person care is important.
So much. Very, very informative. So Now's the time for question and answers. So I just want to remind each of you, there are a lot of other ladies in the room. So if you have any personal questions, please refrain from those and schedule an appointment with our physicians or your own doctor. But what questions do we have? Yes, ma'am.
There's really no rule when it comes to that. So when you have heart bypass, usually you're using at least one artery. Newer surgeries may be using more than one. It's actually, if you like popped your chest open, there's an artery that runs down the back of the rib cage. We call it the lima, the left internal mammary artery. And we take it and we actually sew it onto a native vessel, a vessel you're born with, to bypass blockages. And those last a long time because it's an artery. There is a difference between arteries and veins. I don't think most people are aware of that. Arteries actually have like a muscular wall to them. Those are the ones that take blood to places, okay? They pulsate. And the reason, and the arteries that lie on the vessels that lie on our hearts are arteries. And so using the lima, that one can last for life. That's not always the rule. Sometimes we have to go in and we have to stent within it. But usually the other vessels that are bypassed, they use veins from your legs. And veins are not the same as arteries, and they have problems much, much sooner. Sometimes they can shut off completely. Sometimes they need stents. Honestly, if you've ever had a stent or a bypass or anything like that, you should be seeing a cardiologist once a year at minimum, just to make sure these things don't develop.
Yes, ma'am.
Hi, can you help us? How do we understand our overall health? For example, if we were like very active when we were 40 and doing all these Pilates and all these things, and now we don't. Does any of that stuff back there when we were 40 help us when we're like now? Gosh, I'm glad I got a good laugh out of everybody.
That's an awesome question. Absolutely. The more active you are throughout your life, the more protection you're going to have. I'll give a personal example. My grandmother has lived off the grid in Arkansas and eaten only organic food for 30 years, and she had a heart attack, but she's still moving rocks to this day after her bypass. You know, she's just recovered so fast. So yes, the more active you've been, the better. But it's still worth it to keep up with if you've had, an attack before, to see your cardiologist once a year and to still see your primary care physician, because what if something, really big happened and now our whole lifestyle has changed? We do need to keep a watch on your blood pressure and your heart rate and your cholesterol and your A1C for diabetes screening, because that can change. And going back to my grandmother, it's all genetics that her cholesterol was high. There's no other risk factors there. So, her keeping in touch with her primary care physician is important so that they know, okay, you're on the right blood pressure medicine or you're on the right cholesterol medicine, so that we can keep her going and moving all those rocks that she wants to move.
Yes, ma'am.
Yes. So me and my daughter are currently on the Mediterranean diet. We've heard. Okay. Sorry. When you were talking about symptoms of like heart attack and all of that, chest pain and all that, I've heard that a lot of times, there can be like you said, misdiagnosis, like where inflammation is concerned, like in this specific area, and that, like things like pleurisy. Would the Mediterranean diet help, like lower inflammation levels so that, because obviously, like if you're having chest pain, you're thinking, oh my God, am I having a heart attack? And, just kind of, what would you say is the fine line of, okay, this is some kind of anti-inflammation taking place in my body and not necessarily like a heart attack. Am I making sense on that?
Yes.
Okay.
So I will tell you that people come, obviously, to my office every day for symptoms concerning that they're having a heart attack or, chest heaviness, tightness. And we do a workup. Sometimes the symptoms are so severe that and their risk factors are so extreme that we jump to an angiogram, that's where we can put the stents and the balloons to fix things. But sometimes we're kind of more like in the middle, and that's when we do stress tests and coronary CTs, things like that, to kind of figure that out. But you won't know that unless you go see, in the beginning, it's your primary doctor, and then, depending on what she says or what he says, and get referred to a cardiologist, and then get that workup. I think the biggest thing, and what you'll hear, like the theme of this, is like, just don't ignore your symptoms. Women, we want to take care of everybody else, but we can't take care of everybody else if we don't take care of ourselves first. So don't ignore your symptoms. If you feel like you're getting brushed off, go see somebody else, okay?
Can we get a clap on that?
So that would be my biggest piece of advice, is if you're having symptoms, you need to get worked up. But to answer your question, the Mediterranean diet, I'm not a rheumatologist. You probably know more than I do, but I believe that the Rheumatology Societies also recommend that diet because it does have anti-inflammatory properties to it.
Can you tell us about some of the trends you're seeing in heart health in patients who are also suffering from long COVID?
Oh, that's a tough one. That's hard. So long COVID, when you think of long COVID, you think of shortness of breath from like scarring of the lungs or fatigue. And I will say that back when COVID was the initial COVID, the COVID that people got super, super sick with, we would see that COVID cause heart attacks or arrhythmias or heart failure. Nowadays, sometimes it's hard to tease out, is this long COVID that's causing a lot of these symptoms, or is there something else that's brewing that's new? And again, that's where it comes down to testing. That's very multidisciplinary also with pulmonology and, of course, primary care. So the damage has kind of been done from the initial COVID, but it can still persist, and treating that is something that there's just lots of research going into. We don't have all the answers, unfortunately.
Versus heart disease, heart symptoms.
That's also hard too, because a lot of the medicines that we use to treat esophageal spasms, like calcium channel blockers or nitroglycerins, they treat both esophageal spasm and coronary artery disease. I will tell you, esophageal spasms don't kill you, and so a lot of times we'll first rule out coronary artery disease. Sometimes, the symptoms will be like after I first ate, or when I'm eating something spicy. And it's, it's pretty kind of obvious that, okay, this is more food related than cardiac related. But again, that's where we look at your risk factors. If that's your only issue, then I may not be as aggressive I might still do a stress test. Maybe I'll just choose like a treadmill stress test, and I won't expose you to the radiation and things like that. But that's where medicine's kind of more of an art form, and so you really have to, know the history, know the risk factors. But sometimes esophageal spasm is not food related, and you need to do the workup and see.
We're going to jump back here to the back.
Okay, with diabetes and heart disease, how can you tell the difference? What symptoms would you have with diabetes and the effect on the heart?
So I think that's a great question. I'm going to actually let our endocrinologist answer that during the next panel because she'll give you a better answer than I can.
I'll add to that, though. Diabetics are at higher risk for heart disease, so it's important to pay attention to what your needs are from a diabetes standpoint and also what symptoms you're having. So, again, coming back to us when you're concerned.
I actually had a heart attack in 2023. And just for the concept of the things you've said, it's not like a man. I had what I thought was an ulcer. I'd had an ulcer before. And this went on for about 5 weeks. And I finally called my primary care and said, I think I have an ulcer. Can you, and I've had it, so can you help me here? And he goes, how long? And I said, about 5 weeks. And then he says, well, I'll prescribe you something, but the little ERs I call doc in the box, okay? So I went he said, do this for me, and I'll follow up here. So I went to the Little Covenant over on Milwaukee. If you've never been there, please use it. They're wonderful. Sorry, have to get that ad in. Anyway.
Thank you for that.
So I went there, my husband went with me, because my doctor suggested somebody else drive with me. Now, I've been running all over town. I've been doing everything I do. I volunteer, and I'm a very busy person. Anyway, so I go in. They do blood workup, EKG, and the doctor comes in and says, well, we're sending you to the hospital. And I said, I don't think so. You know us, right? So, and my husband's sitting over there going, yeah, you are. And so I said, why? This is something I didn't know anything about. And I've had a triple bypass many, many years ago. Anyway, they said your heart enzymes are high. I never heard of heart enzymes, okay? So your heart enzymes are high. And evidently they were very high. They took me by ambulance. This is the part of, if you're a Monopoly person, do not pass go, do not collect your $200. Took me straight to a floor and got me all hooked up. I had heard the thing about different than a man. But I didn't have any idea that it could be something that went on for weeks.
So I think that leads us to the question of, if you're having a heart attack or you think someone is having a heart attack, what do you do? Do you call 911? Do you go to your closest ER? Do you wait 5 weeks because you're having an ulcer? What's the best prescription for that?
So if you're having acute symptoms that are severe, you have to call EMS, because heart attacks can be quick, and you can go from, just talking and being able and having normal blood pressures and stable vitals to having arrhythmias that can be life-threatening. And if you're driving yourself, or your friend is driving you, or your husband or whoever, and something like that happens and you become what we say unstable, where you're in arrhythmias that are life-threatening and your blood pressure drops, they can't do anything to help you. Also, there are medications that EMS can give in the field to kind of help stabilize things or temporize things until you get to the hospital. So heart attack, stroke symptoms, you call an ambulance. Yes, and to mention cardiac enzymes that you were discussing, those are called troponins. They're routinely checked, and what they're looking for is heart damage. And that's what that is called, if you hear a troponin.
Hi there. Thank you for being here. Quick question. You had mentioned to be mindful of how much alcohol you consume. Where does kombucha fit in that, with trace amounts of alcohol?
Really great question. I do like kombucha for probiotic. I would have to look into it for heart stuff, though. That's a really great question. I'm not sure that I have seen studies specifically about that for heart health. It's more GI stuff. But I like it.
So I have high blood pressure and high cholesterol. So I'm wondering, is there a type of test, maybe like an imaging test, like a one test, that can detect any type of heart disease, those that you showed up there, that would detect any of those?
Yes, there is. It's called a calcium score. And Dr. Iskander is going to talk to you more about that in the next panel. She has, I believe, a slide about it, so stay tuned. That is absolutely untrue.
Wrong. Yeah, and honestly, one of my big concerns about vaping is there's so much we don't know yet. This is new stuff, and so we will see it throughout our careers of what the fallout will be. But when I was doing hospital medicine, and I'm sure Dr. Hughston still sees this, the vaping lung injuries are scary. And it happens to young people, and it is really hard to recover from it. So no vaping, no smoking. Don't let your kiddos do any of it.
The smoke that you inhale from vape is, don't quote me on this, but like 10 times hotter than the smoke from cigarettes. So you're literally just lighting your lungs on fire. So all the stuff that's in the vape, I don't think we know enough about, but I can tell you that the inhalation itself is just horrendous for your lungs.
So next time you want to smoke or vape, go fix yourself a nice Mediterranean diet meal and enjoy.
Hummus is amazing.
That's right.
Okay, so we go to the doctor, you've got your PCP, and they run regular tests. Can they tell from those, just regular diabetes, or, the regular test, the blood test? Or is there a test that you can do before something happens to you, before you have a heart attack, like you were talking about the CAD? Is there a test that we can request beforehand, or do we just wait until?
From my standpoint, from a PCP standpoint, typically we're screening for diabetes and high cholesterol, which a lot of times we see kind of smolder for years before some of this takes off. So that's the general first approach. There are some other more tailored testing, like for apolipoproteins, that sometimes we'll do on people who either have a very strong family history of heart disease, or they're in their 20s and their cholesterol is just remarkably high. But off the bat, from a PCP standpoint, I don't do that a lot. It's that I'll do it if I need to get them to cardiology.
So we have time for one more question. Yes, ma'am.
So, my sister-in-law, she had a brain aneurysm, but she had diabetes, she's pregnant. Yes. And so she had my niece, she was at 5 at the time when she passed. Is there a certain age she should check, or should you just, when she's pregnant? Because, I don't really know her family history, but, she's 12 now. But is there something that she needs to, look for or be careful with ahead?
So your niece for being screened? Is that what you're saying?
Yeah, because her mom passed. She had, diabetes, and she had a brain aneurysm.
So the brain aneurysm can be tricky because there are certain genetic conditions that can make people more likely to have aneurysms. And so if your sister had that, or we're thinking that she had that, there's some testing that can be done. Usually testing like that wouldn't occur until, at least post-puberty. Realistically more like 18 or 19 sort of thing. But I think it's good for, her to know her mom's history. And so that way she can tell, the pediatrician should all know. But usually a lot of that screening for genetic stuff doesn't occur, at least in my world, doesn't occur until post-puberty.
Thank you, Dr. Hughston and Dr. Lewis. We appreciate y'all being here.